This week's topic, laws, regulations, and ethics. So ethics is a little tricky because it incorporates personal morals into it. So morals are individualized beliefs, principles, values of what is right and wrong. There are society and cultural norms that go along with this. So morals are highly individualized. Anybody live not in the Northeast United States? Nobody's lived elsewhere? Yeah, where have you lived? Where out west? Okay. Anybody else? Where? Okay. Okay. All right. So here's something that I know. So I lived in Hawaii for a little while. Here's something I know, and my brother lives in Tennessee. My dad lives in Florida, so spending a lot of time in those areas. So here's something I know about the Northeast culture. Time is very important to us. When someone's late for you, it's irritating. When you are late for something else, it's irritating to you. We are very time focused in the United States. I mean, sorry, in the Northeast United States. Those of us that have lived elsewhere, is that true everywhere in the country? No. Where are you thinking that it was much less of a problem? Yeah, California and Wisconsin. Yeah. Yep. Any other examples of that? In Hawaii, so my last patient, when I was working out there, my last patient was scheduled to be at 6 o'clock. I had patients showing up at 9 o'clock routinely because time just doesn't exist out there, apparently. It completely boggled my mind. Could not figure that out. Yeah, it's a cultural thing, right? Very different culture in Hawaii versus in the Northeast. So that's just a very small example on how morals can be derived from society and highly individualized. Ethics are much more rigid. They can have a systematic reflection of what is right and wrong. They're influenced by laws. The two that we'll talk about are federal laws and state laws. The collective state laws that govern what physical therapy is called Practice Act. We've said that. Have we said that every week? Have we said Practice Act every week? Just about, right? There's also rules or administrative regulations. We'll look at the APTA and how they, what rules they put forth for us in the physical therapy world. So I like to look at this quadrant here where we can look and assess if something is legal or illegal and ethical and unethical. So ideally, we'd like to stay in the legal and ethical. In the physical therapy world, that's doing a good job, billing appropriately, that's legal and ethical. What if we just had a patient that we just didn't mix with? Just didn't really like them, they didn't like us. Give them a kind of a okay treatment and just kind of ignore them a little bit, like not do our personal best. Where would that lie on this quadrant? Would that be illegal or legal? It'd be legal as long as we're not attacking them in some way, right? Yeah, it'd be legal. How about the ethical and unethical? It'd be unethical, right? So we're not doing our best job, right? So it's up to us to be ethical. And if there's some sort of barrier between us doing our best job, we've got to find that patient a new home, new person that can do their best job, right? So illegal and unethical. we'll look at this later, but I'm usually see this patient Monday, Wednesday, and Friday. Friday they canceled, but I was one visit shy of hitting my bonus. I would have made an extra, $100 if they showed up. They're usually here. They've never missed a Friday, but they missed this one. What if I just write, they were here. They're usually here. Where does that lie? Unethical and illegal, right? The ethical yet illegal is very, very small area. I think a lot of civil disobedience counts as that, right? Protests that shut down highways, like, okay, potentially that fits under that. I'm not a big protest person, but potentially we could see that. I have trouble coming up with direct physical therapy examples of this. It's very, very few and far between. Could something be ethical yet also illegal? Oh, there you go. We have all that. So the major ethical concepts for physical therapy, beneficence is acting in the patient's best interest, always acting in that patient's best interest. I think that is easy to wrap our heads around. Non-malfeasance, do no harm. The big ones we'll talk about is autonomy, respecting the patient's rights for self-determination, and justice, equitable treatment for all patients. So those are the foundational. So we'll talk about autonomy as it comes to informed consent. So making sure our patient's is the driving decision maker. We're there to inform, we're there to advise, but the decision maker has to be that patient. And equitable treatment for all patients, that can be really tough to measure. My simple ankle sprain athlete about to go back to soccer, doesn't need a lot. Maybe they're on their last visit or two. They don't need a lot of skilled care from me at that point. Versus someone who's going through chemo and radiation after cancer surgery for cancer. Now that person's way more complicated. They need a lot more of my time. So equitable treatment doesn't mean I have to see the ankle sprain for 20 minutes and I can only see my other complicated patient for 20 minutes, right? So it's a little bit more difficult to measure that justice. But those are the ethical foundations. Now that patient that was just a pain in the neck, only seeing them for 20 minutes, now that is not doing justice just because I don't like them. I'm not giving them equitable treatment. You had a question? No. Although race, gender, religion, creed, any of that could play into any of these things we're talking about, but no, that doesn't. I think an easy cut and dry is I have one patient that pays cash, $150 to come and see me. Their insurance company pays me $30 to see them. Who should I spend more time with? Yeah, that money factor should not play into it. That is more of that justice. That's where that ethical concept would come into play. So the APTA puts forth ethical guides for us. For the PTA, the values-based behaviors for the PTA, the standards for ethical conduct for the PTA, and guide of conduct for the PTA are those guides. Now there are for physical therapists as well. They are basically have the same titles except say for PT. But these are the three major ones for the PTA. Now, it's important to understand these because if something were to go wrong, whoever feels wronged would pull up the APTA documents and say, did you follow this document? Right. So it doesn't matter if you're a member of the APTA or not. These are the standards that we are held to. So here's the values-based behaviors and you can go ahead and click on these to open up them if you want. All right, so I'll just read them from these slides here. So the value-based behaviors, altruism, devotion of the best interest for the patients above the PTA's self-interest, compassion and caring, continuing competence, that's the lifelong process of maintaining and documenting competence. What are we talking about when we're saying document competence? How do we show continued competence? Documenting correctly, doing our job the right way and showing that. Good. Any other ways? Measuring the patient's progress. Yeah, this talks more about the PTA than the patient.
Staying up to date with like technology and science changes.
Absolutely, absolutely. And how do we do that? Any ideas? I'm sure I bet you have to do this with plumbing. Continuing education. Yeah, yeah. Who has a career they have to do continuing education? As a teacher, you have to. Plumber as well. Yep, yep. Any others? Any other careers that are mandated? You have to do continuing education. In Rhode Island, we have to do 24 credits every 2 years because our licenses expire every 2 years. So that's why it's framed that way. So yeah, making sure that we are continuing to improve and stay up to date on research and technology. Duty, commitment to meeting obligations to provide effective PT to patients, serve the profession, and positively influence the health of society. Oh, that's a big one. That's a big task. Do you guys get into this to influence everybody, the whole society? Well, don't worry, that burden is on your shoulders because the APTA said it is. Integrity, adhering to high ethical standards, truthfulness, faithfulness, honoring your word, PT-PTA collaboration, responsibility, active acceptance of obligations of physical therapy, including positively influencing patient outcomes and the profession and behaviors of society, and social responsibility. This is important. Mutual trust between PTA and profession and the larger public that necessitates responding to societal needs for health and wellness. So the social responsibility is something that can come up, and we'll look at some other ways that these values are going to be important for us. So the next document, standards of ethical conduct. Again, if you want to see the actual form, go ahead and click on that. So the directives, anytime it says shall, it means you have to. So PTA shall respect inherent dignity, rights of all individuals, shall be trustworthy, compassionate in addressing the rights and needs of patients, shall make sound decisions in collaboration with PT and within boundaries established by laws and regulations. Shall demonstrate integrity in relationships with patients, families, colleagues, students, employers. Employers and the public. PTA shall fulfill their legal and ethical obligations. PTA shall enhance their competence through lifelong acquisition of knowledge, skills, and abilities. Shall support organizational behaviors, business practices that benefit patient society. Shall participate in efforts to meet the health needs of society of people locally, nationally, and globally. Any major differences between the two so far? I see a lot of repeated themes. Did you guys see that, or did you guys just fall asleep as soon as I started reading? So I see some people like, yeah, I definitely just nodded out. Yeah, that's okay. It's recorded. If you're recording this and you fell asleep, all right, back it up about, I don't know, 60, 90 seconds or so. I see a lot of repeated themes, right? Addressing the health needs of society is a big one. Ethical legal obligations, relationship between the PT and PTA, practicing within the confines of your federal and local laws. Do you have something? Yeah, knowledge, skill, lifelong learner. Make sure you're up to date on the newest things of the profession. So here's the guide of conduct. We'll see some more repeated themes: respect, altruism, acting the best interest of the patient, making sound decisions. The supervision, physical therapist assistants shall provide physical therapy services under direction and supervision by a physical therapist and shall communicate with physical therapists when status requires modifications of the established plan. So that is that one's spelled out just a little bit more clearly about that PT-PTA relationship and collaboration. Integrity in relationships. Here's the one, physical therapy assistant shall discourage misconduct by healthcare professionals and report illegal or unethical acts to relevant authority when appropriate. So that now means that if we see someone else doing something wrong, now we have to, it is our ethical standard that we have to act upon that. We can't just say, oh, geez, get a load of that guy. Like, no, we have to do something about that. And then exploitation, PTAs shall not exploit persons over whom they have supervisory, evaluative, or other authority. So patients, students, supervisees, research participants, employees. And then here's one, PTAs shall not engage in any sexual relationship with their patients, clients, supervisees, or students. So that is one that I'll pause on for a minute. I will say that is something that can come up a lot in our profession. There's a few reasons for that. One, we're just so damn likable. Like it's just, I mean, look, everybody around here, we're just likable people, right? Where what is the makeup of someone who's a PTA or a PT? Give me some like personality traits. Like if we did this, if you said, okay, here are the personality traits of someone who would be a librarian, we'd be able to say, well, they're probably quiet, they love books, you know. What are the personality traits of a PT or PTA? Nice, easy to talk to. Good. Give me some more. Empathize, caring. I thought you were going to say good looking, but yes, good listeners. Yes. Also, what else? Good looking, helpful, active, smart. Sounds like a winner to me, right? Here's the other thing. Because we're so empathetic and we care about our patients, we truly care about our patients. I've got patients come to me for their shoulder pain, and I take the time to listen to them and truly try to understand not only about their shoulder pain, but how is it impacting their life, and what about your life can I improve upon? I might be the first person in years that actually cared about that person. And I not care, like that person has other people that care about them in their life, but who's so busy that can't remember the last time that somebody just checked in and said, hey, tell me how are you doing? No, I really want to know, like, what's going on with your life? Everybody's wrapped up in your own, right? So, and that is okay. But, you know, it's easy for our patients to fall for us because we are so engaged with them. And it's easy for them, those strong emotions of, oh my God, this person's really helping me and they really care about me. It's very easy for that relationship to change from a caring caregiver role to evolve into something else. So we definitely have to be careful with that. This is a pretty specific one. PTAs shall encourage colleagues with physical, psychological, or substance-related impairments that may adversely impact their professional responsibilities to seek assistance or counsel. PTAs who have knowledge of that colleague is unable to perform their professional responsibilities shall report this information to appropriate authorities. So there's another one that's pretty specific that's demanding that we take action if someone else is screwing up, which is, I think, pretty unique. Shall achieve and maintain competence, yet again, a lifelong learner. So there's some others here. Health benefits of society again, ensure documentation is accurate, and then support the health needs of people who are economically disadvantaged, uninsured, or underinsured. So, you know, boy, that's a lot on our shoulders, right? I mean, we're not just working with the people in front of us. We are ethically obligated to truly do the best we can for all of society, and in a couple of instances, to report those who are acting inappropriately that is required of us. So ethical conduct in medicine, first is informed consent. I think this is the biggest thing that we have to understand and know. is the patient should be the driving decision maker. At a minimum, this goes for all healthcare professionals, not just in the PT world. So I want you, last time you had to make a medical decision, I want you to ask yourself if your healthcare provider went through these steps. So at a minimum, the medical provider has to give the evaluation findings, the recommendation of treatment, the risks and benefits of that treatment, an alternative treatment we could choose from, and the risks and benefit of that treatment. And the patient has the power of which to go into lies in the patient's hands. How often, if you can think of your own medical interactions, how many times does that happen? Not a half. Sometimes we can't, right? If we showed up to the hospital down the road unconscious, they can't say, no, don't do anything. They haven't decided what to do yet. Well, no, sometimes in emergency situations we can't. But you know, in the physical therapy world, if someone has a lot of neck pain because they have a muscle that is in spasm for some reason, I can improve upon that muscle spasm. There's a bunch of different ways I could do it. You guys, anybody ever have a muscle spasm? Right? You just go like, God, this muscle just won't relax. Why does it hurt so much? What are some of the treatment ideas that you guys have on that? Dry needling. Dry needling is a perfect one. I want to come back to that. Who's got another good one? Massage, great. Bunch of different types of massage techniques, but yes, broadly speaking, massage. Good. Any others? Ice and hot. Yep, good. Any others? So, listen, here's how it will go. Hey, listen, you know, you have a lot of pain, and this muscle right here, this is called the levator scapula. This muscle is just in complete spasm, and we've got to, once this muscle relaxes, you'll be in a lot less pain. I would like to do this thing called dry needling. I insert these little needles into it. It's been shown to reduce muscle spasm. I could attach these electrodes to it to send a little electrical signal to help that if we need to. Some of the risks are anytime we puncture the skin, there is risk of infection. It's less than 2%, but that is a risk. But the benefit would be, I think we can get this much improved within a half an hour. Alternatively, we don't have to do the needles. I could try massaging this area a little bit. I know you've been doing some of that on your own. I have a couple of different techniques that I can try. There is some risk of bruising with any sort of massaging, but I think it'll help, and it might just take a few extra days or weeks instead of a little bit quicker than I think the dry needling would be. What do you think? What do you want to try? Right, that's what informed consent is. Now, if your patient's afraid of needles, what are they going to choose? Massage. I'm not doing those needles. Get those out of here, right? But that's what informed consent is, and it's giving the power to the patient to decide what to do.
How do you inform them that it's going to be like? Did you tell them like it's going to hurt pretty bad? Or...
Yeah, absolutely, absolutely. Because if I don't do that, how am I supposed to maintain patients' trust? Absolutely, the trust is gone if I don't do, if I know something is going to be irritating right now, but I really think if we get through that, they're going to be benefit. If I don't say that, it is one, it's breaking trust. Two, there could be a question of assault because I did something and someone was hurt because of it. There could be some. It's a tough area to do that, but if I don't get informed consent, it makes it pretty easy to say, what wasn't the case, man? So, good question. Yep. Yeah. Yep. So sometimes our patients say something we did made them get worse, but it's not. Right? I've had plenty of patients. I had one patient, he had a speedboat when I was working in Middletown, and so he had this speedboat, and he would go on he had back pain, and he'd go. You guys ever see those massive speedboats that then just pop, 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 pop right across the water? So you do that all weekend long, and then come in and complain about the treatment I gave him on Friday. And I said, I don't know, man. I'm pretty sure it was that speedboat action he had. He goes, no, no, no. How long are you on the water for? All weekend long. All right. So sometimes our patients are going to be telling us, no, no, it was the squat you made me do and not the boating all weekend. So sometimes that does happen. Our job is to do what? Listen, educate, tell them the risks and benefit of our treatment, give them an alternative and the risks and benefit of that. And it's up to them to choose. Yeah. So yeah, that can happen. Boy, I haven't thought of that guy in years. That guy was a big jackass. Anyway, let's talk about more laws and regulations and policies. So the main reason laws that govern the PT field is number one, to protect the public safety. Two, to ensure that providers are competent, and then three, to ensure that tax dollars are being spent appropriately. Those tax dollars are Medicare and Medicaid. So we'll go through some federal laws and their impact with physical therapy. So the Americans with Disabilities Act, ADA, prohibits discrimination against persons with disabilities, includes employment, public service, public accommodations, and telecommunications. So employment will require employers to make reasonable accommodations for qualified people with disabilities. Actually, not only well, it probably fits in a little bit differently, but you guys saw the desk over there with the big sign that says disability services do not move, right? That reason is there is because of the ADA. Someone needs that, student or professor, I'm not sure who, but someone needs that, and the ADA says you have to use that, have to put that in. So reasonable accommodations can be a little tricky. Changing where someone's desk is, giving someone a microphone to talk, a special phone, like this, all of those would be reasonable accommodations. My house was built, the foundation of my house is pre-1900. Who else either lives in or works in a building that's really old? All right. So how easy would it be to modify those really old houses to fit a wheelchair in and out and down the hallway? Really tough, right? Just there's no space, everything's tight. So the reasonable accommodations are, there's the term undue burden. The employer is not asked to make undue burden. We can't move our whole building because we can't put a ramp outside. So there is some exceptions to the rule, but reasonable accommodations should be met. Public service, access to local government. And actually I live in North Kingstown. This was something, because of the age of the town hall, this was something that was a big problem because it was no longer ADA compliant, and the public needs to access the government. That's one of the founding fathers said, no, we need to be able to do this. So the town had to renovate town hall and had to put it in a different place while it was being renovated. It was a whole big thing. But yeah, people need to be able to vote. And actually, that's one of the reasons why mail-in ballots started happening, is so that someone could still access their government and have their voice heard. Public accommodations include building codes, doorway widths, actually which type of door handles are on there. If we look at the door handle, it's going to be a lever type and not a knob type. If you've ever had kids, my daughter, she's 2 now, 2.5 almost. She can open lever handles, but not the knob type. Lever handles way easier to open. It also talks about ramp slope requirements. So there's a specific pitch that has to be, and if it's too steep, then it's really tough to go up or unsafe to be going down. As well as parking lot access, hotel room access. At least 2% of parking lot spaces have to be deemed handicap accessible. Same thing for hotel room. Anybody ever snag the handicap accessible hotel room? The last one? No? Oh, yeah, it's the best, isn't it? Yeah, gigantic, huge bathroom. It's the best. So, also telecommunications, closed captioning TV is one of them. Actually, when I put my videos on YouTube, I press the captions button just for if any student possibly needs it. So that was all part of the ADA. Others, HIPAA, health insurance portability and accountability. Among other things, it has to do with protecting the patient's confidentiality. Information shared between entities have to be as minimum as possible. It covers verbal, written, and electronic forms of communication. So this is something that happens frequently with me. I've got patients that need new walkers. They need, that's the most common one. Sometimes toilet risers, sometimes commodes, sometimes more extensive things like Hoyer lifts and like big expensive equipment. So I call a vendor. I call, Larry's wheelchair shop. And I say, hey, Larry, I have a patient, needs a new walker. The information I get to share with Larry's wheelchair shop is the minimum amount of information that person needs to get done. I get to share diagnosis. I get to share which insurance that person has, who their doctor is, important findings that would help justify why this person needs a walker. I don't get to say, oh, and by the way, they also have this diagnosis that isn't part of their walking problem, but get a load of this one. Like no, that's now sharing too much information. That's breaking the patient's confidentiality. So keeping it as minimum as possible. I'll tell you one thing about the HIPAA that the company I worked for got in trouble. So I was at outpatient clinic, and this guy's wife calls up, hey, was Johnny in today? And the front desk worker said, no, he hasn't been in today. That son of a b, I knew he was cheating on me. The guy was telling his wife he was going to PT 5 times a week, and he was seeing his girlfriend at least 2 of those. Technically, that was a HIPAA violation. We're not allowed to tell even a spouse whether they are not a patient of ours. Luckily, that guy had bigger problems to deal with than us. But I mean, technically, that was a HIPAA violation. It's a non-emergency. Yeah, we can't be sharing that information. And then the Affordable Care Act. The Affordable Care Act was intended to reduce the number of uninsured Americans and reduce the cost of health care. Debatable whether it did either. I did do it better for the uninsured. I'm not sure about the cost of health care. But one of the things that it did do is it helped improve the use of technology in medicine and electronic communication and electronic records. So violating federal laws include consequences that range from fines, injunctions. So an injunction is just a demand, maybe, okay, your clinic is not ADA compliant. Here's an injunction. You have to do this. Or potentially jail because it could be fraud. So fraud is a huge problem. It costs Medicare $60 billion a year, and every single one of us pays into Medicare through our taxes in some way, form, shape, or another. So this Erie, Pennsylvania physical therapy chain was charged with $22 million of fraud over a 14-year period. There were 21 defendants in the case. 2 of them were owners, but 10 were PTs, staff PTs, 8 were staff PTAs, and 1 was a billing accountant. And of these PTs and PTAs, a lot of them started with this clinic as technicians, as rehab aides. I mean, if you wanted to read the article, it is, can't do that. Okay. But try to find that. Maybe off campus, it'll work. It is a pretty fascinating read. And they were doing a lot of things where, the PT was on vacation, yet bills are being submitted that they were treating patients, even though they were even in the state at that time. So the textbook also cites one case, not care, but case where a PT and a PTA were each sentenced to over 4 years in prison in order to pay $7 million in restitution, paying back $7 million. So it is a huge problem. And this is one of those things that if we see it, we've got to call out those professionals. I shouldn't call them professionals, but those people doing that. State laws. So again, we say this almost every week at least, is the collective laws that govern physical therapy in each state is called a practice act. Each state has its own practice act. It includes the definition of PT practice, who the providers that can participate in the delivery of PT care are, some specific treatments that can or cannot be performed, which tasks can be delegated to other staff like PTAs or techs, and supervisory requirements. What are the supervisory requirements of PTAs in Rhode Island? What is it? There has to be a documented supervisory meeting every 14 days. What else? What is it called? Indirect or general? General supervision. So general supervision means the PT is available how? Telephone, telecommunications. Good. So there are some variation between states. So direct access is one of the hottest topics and has been for the last 30 or longer years. Direct access is the ability for patients to access physical therapy without a physician referral. Every single state has some version of this. Some of it is still really restrictive. Others is much more wide open. The tough thing with it now, even if the state allows for it, it doesn't mean the insurance will pay for it, which is, all right, well, that's too bad. But some treatments, specific treatments, dry needling, not every state of physical therapist can perform dry needling. Spinal manipulations in Rhode Island, I can do spinal manipulations. In California, I cannot. And wound debridement with sharps, that's removing dead tissue from wounds. Sharps are scalpels, tweezers, other things like that. PTAs cannot do any of these three forms of treatment. You can do wound debridement, but with non-selective things. There's one that's like a little squirt gun you get to put on a wound to help remove tissue. Each state also has slightly different licensure requirements. So the licensure requirements, at a minimum, you have to graduate from a CAPT approved school. That's every single state. Every single state, you have to pass the licensure exam, which is created by FSBPT. We've talked about those, I think week 1, maybe we talked about those. So all states, you have to pass that exam. However, there are some states that have different minimum scores for it. So you might, if you got, a 660 on that exam, great. You can be practicing PTA in Rhode Island, but you can't practice in Ohio because they require 680. So there are some differences with that. You have to be of good moral character. So, man, that's a little vague for me, but basically it means you have to pass a background check. Some states have an in-person interview or in-person oral exam. That's very unusual now. I think it used to be the norm, but now it's unusual. Some states have a State Practice Act exam. When I was licensed in Massachusetts, I had to take Massachusetts' state exam. Rhode Island, I didn't have to. They didn't have a individual's practice exam, state exam. And then continuing education requirements. And each state has slightly different numbers. In Rhode Island, it's 24 hours and 2-year period. Professional misconduct is handled at the state level by the State Board of Physical Therapy. So the State Board of Physical Therapy is within the Department of Health and has 4 major rules. Proposed regulations that impact physical therapy. Approve students to sit for the licensure exam. Grant licensure to physical therapists and physical therapist assistants, and then handle complaints against PTs and PTAs. So misconduct complaints can result in a reprimand. Reprimands are basically a written warning. Don't do that again. Prohibition of license. That can range a whole lot of different variations between that. Most of the time, it means that your notes have to be supervised by someone else. So now instead of being an independent practitioner, now you have to have either direct or general supervision where you didn't have to have it before, or suspension of the license. Now, these complaints can include ethical violations, not just legal. The State Board of Physical Therapy can only act on your license. If you do something illegal, that is for the police to handle. But the State Board of PT can only assess penalties to your license to practice. Actually, I want to take a quick second. Let's see. Let's see. There was. I'll find it in a minute. When I have you guys do your special project, I'll pull it up. Most of the prohibition and suspension of licenses have to do with ethical violations, not legal. The most common ones I can remember have to do with substance abuse. I know of one where I don't think it was in physical therapy. I think it was a nurse stole a prescription pad from her doctor, not who she was working for, but her doctor, and was writing narcotic pain medications with it. So that had nothing to do with her job, but an unethical thing. You can no longer be trusted to work as a medical provider. So those are the most common ones. I know another one. The guy was. I think this was a PTA. I'll try to find it. Drunk on the job, working with patients. So that was another one. So negligence is the failure to act as a reasonably prudent person would. There has to be 4 elements. And if you do fall under all of these 4, then you would be deemed negligent. And now you're at risk of both legal and civil penalties. So the therapist owned a patient legal duty of care. So that means there was an established, you are a patient of mine. Therapist failed to provide appropriate standard of care. Patients sustained injuries or damages, and they were directly caused by the therapist's failure to provide the appropriate standard of care. So all 4 of those have to happen. So even if we make a mistake, as long as there's no injuries or damages, All right, don't worry.
About, we had a lady at the PT clinic that fell while she was doing exercises.
Yep.
How does that come into, the negligence?
Okay, so let's go. So a patient fell while doing exercise at the clinic. That's a perfect example. All right, let's see. Do they meet criteria number one, therapist owned patient legal duty of care? Yes, she was a patient. Okay. So there's the trick. Did she get hurt or have any other damages? Other damages could be I fell on my water bottle and the water bottle broke. Okay, well, we owe you a water bottle. Like, but that's damages, right? So I have patients get in their cars and drive me around when I think they're ready for discharge from home care. If they weren't ready and crashed their car, those are damages, right? So that's what damages mean. All right, did she get hurt or have any other damages? Bruise, pain? Okay. Okay. All right, but that's good. But sore pain is still, that counts. All right, let's go to number two. Failed to provide appropriate standard of care at the time of injury. So this is where our details matter. Was the patient wearing a gait belt? You guys know what a gait belt is? Gait belt's fabric or plastic that goes around the patient's waist that the therapist can hold on to help prevent a fall. Was the patient wearing a gait belt? Uh-oh. Right, because even if the patient was wearing it and we weren't using it, hey, at least they were wearing it. We took that step of safety. All right, but yeah, I would. What do you think the lawyer's going to say? Lawyer's going to say, were they wearing a gait belt? And if the answer is no, they're going to get excited. Say that again. Yeah.
PTA almost thought it, but she kind of like went down slowly.
Yeah, no, I understand. Yeah, no, I get it. I get it. So here, the appropriate standard of care. So if they're not wearing a gait belt, now I am uneasy. Even if the patient was wearing it and we weren't touching it and they fell down, at least they were wearing. We applied the safety device we had at our disposal, right? So that's where it makes me a little nervous. So was the therapist guarding the patient? Guarding means standing by, standing close, or were they doing notes? Where there's the patient doing notes 10 feet away while the therapist is doing notes? There's another layer of what should the standard of care be? The standard of care when first of all, who does balance exercises? If any of us went into physical therapy right now, would any of the physical therapists say, we'll give you some balance exercises today? No, who needs to do balance exercises? People with balance problems, right? So doesn't matter that they walked into the clinic. We're doing balance exercise because they have balance problems. And actually, it's probably thoroughly documented what kind of balance problems she had, right? So, all right, no gait belt. And if the therapist was close guarding, but just didn't catch the patient, what do you think? I don't think that's negligence. If the patient's doing exercise and the therapist is doing notes, now you're on the hook. Do you see how that's very subtle but very important details?
I've had people like ask me if I've been working there. It's only been a couple of weeks.
Yep.
To, like, help them stand up. I'm not even like gonna try and grab an arm or something. I go get the PTA.
Yeah. Yeah. Yeah.
I'm all set with that. I'm not ripping somebody's arm out of it.
Yeah, absolutely. Yeah, and actually, so who would be on the hook in that case? Would be whoever's supposed to be supervising you as a tech, because you're not a trained person. Why are you doing that? But yeah, that's where I would put that.
How about someone in the hospital grabbing a oyster, lifting the patient from the bed, putting in the chair, but because the pressure grew because they didn't put well the oyster what they went on the baby.
A pressure wound's not typically, a pressure wound is typically created after prolonged contact. It's not like a one-time thing. Yeah, I'd have to look into that a little bit more. Yeah, yeah.
Also, right in bottom, let me check it.
Oh, okay. All right. Gotcha. Gotcha. I bet. Yeah. Yeah. Um, I'll tell you one horrific one. I had a friend who was a expert witness for some lawyers, and he had one case, PTA in Connecticut, working at a skilled nursing facility. Patient had a knee replacement. PTA was transferring the patient from their room to the PT gym using a wheelchair, but the wheelchair didn't have leg rests on it. And the PTA said, "Oh, just hold your legs up." So the patient was holding their legs up as they're wheeling down the hallway. Patient started getting fatigued. So what happens to her legs? Comes in contact with the ground. What then happens? She gets rolled onto, right? So that actually the PTA was distracted at that moment. Somebody asked her a question. She looked over and she drove over the patient. Bent her knee really far back. As you could imagine, that mechanism would just completely bend that. Ripped open the wound, ripped open the surgical incision. It became infected and she died 2 weeks later. Okay, let's go through this list. Number one, yes, she was a patient. Appropriate standard of care at the time of injury. What is the only thing that therapist needed to do? Put Forests on it. Go grab them from the closet, put them on. Yeah, they're a pain sometimes. Yeah, they're buried in the closet somewhere, but they're there, right? Did the patient sustain injuries or damages? Heck yeah. Directly caused by result of the therapist's failure? Yep. Yep. So yeah, that person was unfortunately on the hook, and you know, I say unfortunately for that therapist. I think the patient got the worst end of that. Um, but luckily, I mean, I gotta tell you, so much of your education, your formal education, is what not to do, what safety things. I mean, we talk about safety every single day, every single aspect that we teach someone. Okay, here's how we're going to teach you how to do it. Here's how to be safe, and don't ever do it for this type of a person. Like, what not to do is more important than what to do. It does. Yeah, it does. But I know, I know, I know. But I mean, I can also see like, geez, that therapist is behind schedule. They're getting yelled at by their bosses to maintain productivity. They got to get to the gym quickly because, they're on the clock for 8 hours a day and they have to bill so many minutes of that day. I could see it happening. Who's a parent in here? So I never understood this until I became one. You guys ever hear stories of like the car seat was left on the trunk of the car, on the hood of the car, and the parent drove away, like those horrific stories? I could never understand that until I became a parent. And with that newborn was so tired. You guys know that newborn tired where you go like, I can't believe I remembered to brush my teeth today. Like that, how tired. Do you guys remember that? Am I the only? No, you're looking at me going, my God. So I never did that. But I could also understand being so tired that you forget those basic things of how could you do that, right? So I do have some empathy for, even at his work, that nobody wanted that lady to fall. They just didn't put the gate belt on, like it's easy not do. Of course she was. Everybody knows her. If she was on her second visit, she wouldn't have fallen because we would have been right there. But because she's been a patient there for years at this point, it's Betty. Betty, come on in. Go over there. We'll be with you in a minute. Those are the times we're getting in trouble. Those are the times that we cut corners. Yeah. All right. So that will be it for now.